A healthcare reform meeting draws a huge crowd. Good evening, I'm Ben Handelman. More than 150 people squeezed into the Urbana Public Library this morning. Angry taxpayers demanded Congress fix our nation's healthcare system. ABC News Channel 15's AJ Bideport spoke with a few of those people and has their story.
The Campaign for Better Healthcare, a political group, hosted the town hall event. Speakers directed their anger in two directions. First, at health insurance companies raising their premiums, and at Representative Tim Johnson, who did not show up even though the group gave him an invitation. One of the speakers faces uncertainty surrounding an expensive surgery.
It has taken a terrible toll.
Jennifer Putman needs a second hip replacement. The operation will cost her about $40,000. She worries about how she'll pay for it since her employer laid her off in December.
And it wasn't for poor performance or being a laggard or a slouch or bad work ethic. Hard times, my company just couldn't keep the payroll coming and the work was slow.
Supporters of reform say we need it because insurance companies have gone too far.
They're denying people access to health care. They cherry pick people. When I use the word cherry pick, it means that they only want to insure the healthiest of the healthy.
Opponents say that might be, but we can't afford such an expensive overhaul. According to the Congressional Budget Office, the current reform plan includes more than $1 trillion worth of government-funded coverage. Savings through spending changes add up to $219 billion. New revenue from taxes on the wealthy would bring in $583 billion. Overall, the reform would add $239 billion to the deficit by 2019.
The cost of inaction is going to be 10 times worse than us moving forward. For people who currently have health insurance right now, those premiums are going to nearly double within 6 to 7 years.
If action includes taxing the wealthy, some will argue Uncle Sam is penalizing people for having success. One of the panelists says she understands those concerns, but says many low-income people work just as hard.
Yes, there are people that may be low income, may not be employed, and that need these services, but you don't understand the full extent of the reasons why they may be in these circumstances.
While lawmakers work, Putman will try to keep from worrying.
On days when I'm kind of depressed, I put this shirt on and I say, we can do it. You know, we can get that job, and yes, we can pass health care reform.
This is a copy of the report from the Congressional Budget Office. The CBO reminds readers this estimate does not include costs of supervising the changes or how it could affect other government programs. In the newsroom, AJ Bideport, ABC News Channel 15.
Thanks, AJ. Representative Johnson will hold his own town hall meeting in Danville. It's at City Hall Monday night at 5:30.